Hello and welcome to SENDIASS Rutland.
Social care. Would you like to know more about social care support for you and your family? Would you like to understand how to access support? And would you like to understand more about the transition to adult services? Local authorities have a legal responsibility to help families with disabled children. Many children have additional needs and disabilities, and some are more severely affected than others. Some disabled children, their parents or carers and siblings will need practical support both inside the home and outside it. Social services departments of local authorities are legally responsible for arranging support for disabled children, their siblings and their carers. You have a right to have your child and family's needs assessed by social services. The legal duties of social services to disabled children and their families include maintaining a register of disabled children, providing information about services which may be available, assessing the needs of disabled children and their carers, and providing a range of services to meet these needs. Social services responsibilities. Social services departments have a general duty under Section 1710 of the Children Act 1989 to safeguard and promote the interests of children in need and to promote their upbringing by their families. The law recognises disabled children as being in need. Children in need are defined as children who are under 18 years of age and are unlikely to achieve or maintain or to have the opportunity of achieving or maintaining a reasonable standard of health or development without the provision of services by a local authority, or whose health or development is likely to be significantly impaired or further impaired without the provision of such services by a local authority, or are disabled. Definition: disabled. Section 1711 of the Children's Act 1989 states that a child is disabled if they are blind, deaf, non-verbal, suffer from a mental disorder of any kind, or are substantially and permanently handicapped by illness, injury, or congenital deformity, or such other disability as may be prescribed. Where a local authority is under a duty to undertake an EHC assessment, this will include a specific duty to assess their social care support needs.
What support could the Council offer? Rutland County Council break their support into 3 levels. Universal intervention, low-level needs. Early help intervention, additional needs. And targeted intervention, children with complex health and disabilities. And specialist, complex needs requiring social care. Level 1, universal intervention, low-level needs. Children at this level may have a small number of low-level additional needs, such as speech and language delay, which can be met by a single agency, the family, community, or access to a universal provision such as schools, GPs, health visitors, children's centre, etc. For more information on the eligibility criteria and what you can access, you can find the link in the details below. Level 2, early help intervention, additional needs. Children likely to have a number of additional needs and are unlikely to achieve full potential without additional support above universal provision. Children likely to require a lead professional and coordinated support through a team around the family approach. For more information on the eligibility criteria and what you can access, you can find the link in the details below. Level 2, targeted intervention, children with complex health and disabilities. including profound impairments and life-limiting conditions where services are already in place to meet these needs, and as such, there are no safeguarding concerns and a child does not require statutory help and protection. For more information on the eligibility criteria and what you can access, you can find the link in the details below. Level 3, Specialist, complex needs requiring social care. Children with complex health and disabilities, including profound impairments and life-limiting conditions, where parents or carers are unable to and require additional support to provide care. Children who, due to their level of complex needs, have safeguarding needs and require protection. For more information on the eligibility criteria and what you can access, you can find the link in the details below. How to apply for help. To receive help and support from Rutland County Council, you may be referred to, or you may contact directly, the Early Help Team for an early help assessment. Call 01572 772 577, extension 7493, or email earlyhelp@rutland.gov.uk.
How do I access these services? An assessment is the process social services use to gather information about your child and family, so they can make a decision about what help you may need. The process for carrying out an assessment is contained within statutory guidance, working together to safeguard children. This guidance tells local authorities what they must do to meet their legal responsibilities to families with disabled children. It's up to each local authority to decide how much detail is needed in each assessment, but the maximum time frame for any assessment is 45 working days from the date they get a referral. Preparing for an assessment. It can be useful to make a list of questions before you meet, and you are entitled to have a friend or an advocate there with you. The social worker may also want to speak to your child's health visitor, doctor or school to help them get a full picture of their needs. What to expect at an assessment. A social worker will usually come to your home to talk to you. They should ask you for information about your child, for example, sleeping patterns, eating habits, how your child communicates, what activities they enjoy, and whether you have any other children to look after. Don't be worried about asking for clear information about the focus of the assessment. It is an opportunity to have a conversation about how to meet your child's needs, but do remember that the assessment should be based on yours and your child's needs and not based on services already available. What if an assessment has been carried out in the past? When services are already being provided, the assessment should be reviewed regularly. But if your circumstances have changed, you can ask for a reassessment or review in the same way you ask for an assessment. What if I am refused an assessment? If your child is disabled and in need of services, you can't legally be refused an assessment. You don't need to have a diagnosis for your child to get an assessment or help from social services. It can sometimes take time before a diagnosis can be made for a number of reasons. You are entitled to make a complaint and then go to the local government and social care ombudsman. Moving into adult services. Disabled people over 18 years old have their needs met by adult care and support. This means that a disabled child receiving support from children's services will be transitioned to adult care and support when they turn 18. In England, the rights to services and support for disabled adults and their carers are covered under the Care Act 2014. Provisions under the Act should ensure that there is no gap in services when a young person makes this transition.
If a young person is likely to have care and support needs as an adult, Rutland County Council must complete a transition assessment before they reach 18. For more on this, you can view the Rutland Transition to Adulthood Information Guide, which can be found in the links below. How does it work? The young person, parent, carer, social worker, or other professional can start the transition process. Once the transition team has received a request, they will allocate your family with a worker. This worker will then visit you and your family, the school, and any other professionals involved in the young person's care. If support needs are identified, the social worker can help you and your family to arrange support. If you are not eligible for adult social care support, the social worker will signpost you on to other services, voluntary agencies, and support groups who can assist. Young people can be supported with their transition into adult services by the Independent Advocacy Service in Rutland, which can be found in the links below.
Carers and young carers. Your needs as a carer. Any assessment of your disabled child should take into account the needs of the rest of the family members, including parents and siblings, and consider their needs as a carer and capacity to continue with caring. However, the aim of a carer's assessment is to give you a chance to tell social services about the things that could make looking after your child easier for you. This may result in getting services or direct payments to meet your own assessed needs.
Examples of services that can be provided include help with driving lessons, housework, and gardening.
How to tell if you are a carer. You're a carer if you're looking after someone regularly because they're ill or disabled, including family members. Carers help with washing, dressing, or taking medicines, getting out and about and travelling to doctor's appointments, shopping, cleaning and laundry, paying bills and organising finances. They can also give emotional support by sitting with someone to keep them company, and watching over someone if they can't be left alone. The carer's assessment. A carer's assessment focuses on the carers and their needs. The key 3 questions you will be asked are: 1. Are your needs the result of providing necessary care to someone? 2. Does your caring role affect your ability to achieve any of the outcomes? 3. Is there a significant impact on your well-being as a result of the above? Outcomes. Social services will assess if the carer's physical or mental health is or is at risk of deteriorating, or the carer is unable to achieve any of the following: carrying out any caring responsibilities the carer has for a child, other parenting or caring responsibilities for a child, providing care to other persons for whom the carer provides care, maintaining a habitable home environment, managing and maintaining nutrition, developing and maintaining family or other significant personal relationships, accessing and engaging in work, training, education or volunteering, making use of necessary facilities or services in the local community, including recreational facilities or services engaging in recreational facilities. For more and where to apply, visit the Leicester City Council portal. Outcomes continued. Wellbeing covers the areas below: personal dignity, including treatment of the individual with respect, physical and mental health and emotional well-being, protection from abuse and neglect, control by the individual over day-to-day life, including over care and support provided and the way it's provided, participation in work, education, training or recreation, social and economic well-being, domestic, family and personal, suitability of living accommodation, and the individual's contribution to society.
For more and where to apply, visit the Rutland County Council Carers Assessment information in the link below, or call 01572 758 341 or email carersteam@rutland.gov.uk.
Young carers. Young carers are children under 18 with caring responsibilities, and their rights to be assessed come mostly from the Children Act 1989 and the Children and Families Act 2014. A young carer probably cares for a brother or sister. They may do extra jobs in and around the house, such as cooking, cleaning, or helping someone get dressed and moved around. They may also give a lot of physical help to a brother or sister who's disabled or ill. Along with doing things to help their brother or sister, they may be giving them and their parents emotional support too.
A young person or their parents can request a young carer's assessment to have a social worker assess the needs of the family. To request a young carer's assessment, call Rutland's Referral Assessment and Intervention Service on 01572 758 493. There are support groups for young carers available: Little Stars, Young Starts, and Time Out for Us.
What help might you get after a decision about your needs? If the local council decides that you do have eligible needs, then providing you want them to, they have a legal obligation to meet these needs, subject to a financial assessment, and must draw up a support plan detailing how these needs will be met. It may be agreed that the best way to help you as a carer is by providing services directly to you, providing services to the person you care for, or a combination of both. The support plan. The support plan must include details of the needs identified in the assessment, which needs meet the eligibility criteria, which needs the local council is going to meet and how, the outcomes that you want to achieve, information about the personal budget available, which is the amount of money that the local council has worked out it will cost to arrange the necessary support for you, information about direct payments, information and advice to support you in your role as a carer and address your needs. For more information and examples, please see the Carers UK website.
Rutland-based organisations. Little Stars and Young Stars, ages 5 to 7 Little Stars and ages 8 to 12 Young Stars. Fun group for young carers, siblings of children who have additional needs, and birth children of foster carers. Provides games, outings and counselling. Time Out for Us, TOFU. Support group for children and young people aged 11 to 19 who have caring responsibilities at home. The Carers Centre Leicestershire and Rutland, CLASP. Leicestershire and Rutland-based charity dedicated to supporting family carers who look after people with different needs. Aiming High. The Aiming High team provides support and specific activities for children or young people with special educational needs or disabilities and their families in Rutland. Rutland Disabled Youth Forum. A group of young people aged 14 to 25 with a variety of disabilities that help to make sure their voices are heard about the services, facilities and accessibility in and around Rutland. Rutland Rotaract Family Support aims to provide social, recreational, educational and therapeutic support to children and young people 0 to 25 with SEND and their families. And the Parent Carer Voice, a group of dedicated parents and carers of children aged from 0 to 25 with a disability or special educational needs who live in Rutland.
National organisations. Barnardo's, protecting, supporting and nurturing the UK's most vulnerable children. Carers Trust, giving carers a voice and highlighting their work to the general public. Carers UK, they give expert advice, information and support to carers and those being cared for. Citizens Advice, they give people the knowledge and confidence they need to find their way forward, whoever they are and whatever their problem. Contact a family, supporting families that have a disabled child. Council for Disabled Children, umbrella body for the disabled children sector, bringing together professionals, practitioners and policymakers. Family Fund. Family Fund is the UK's largest charity providing grants for families raising disabled or seriously ill children and young people. Family Lives, a helpline for families to receive information and advice. Family Rights Group, they work with parents whose children are in need, at risk or are in the care system. The Children's Society, they work to empower young people to make positive changes and rediscover their hope. And Turn to Us, a national charity providing practical help to people who are struggling financially.